Drug interactions. Introduction. Mixing two or more drugs together in the body can sometimes create havoc, and instead of a health benefit, the patient suffers a setback. Worse, you may be confronted with a health crisis. Most people think these unintended effects apply only to prescription drugs. However, dietary supplements and even the food we eat can interact with each other, or with over-the-counter or prescription drugs, to cause problems. Types of drug interactions that you need to be concerned with can basically be summarized as follows. Drugs interacting with drugs. Both prescription and over-the-counter medications are included in this category. For instance, taking oxy antacids during a course of the antibiotic ciprofloxacin cipro lowers the effectiveness of the antibiotic. Drugs interacting with dietary supplements. There are many documented cases of herbs and vitamins interacting with prescription and oxy drugs. It was recently discovered that St. John's wort can interfere with the action of irinotecan, a standard chemotherapy drug. St. John's wort also acts with the blood thinner warfarin and the heart medicines digitalis digoxin, lanixin, making them less effective. Drugs interacting with food and beverages. Taking ciprofloxacin with coffee, chocolate, or even a cold drink that contains caffeine may cause excess nervousness or manic behavior. If foods containing tyramines such as cheese or soy sauce are mixed with some NAO inhibitors, a class of medication most often prescribed for mood disorders, there can be a fatal increase in blood pressure. The U.S. Food and Drug Administration (FDA) has been trying to understand more about drug interactions, particularly in the past 15 years or so, and has been developing laboratory testing programs to reveal possible problems early in the game. Because clinical trials with humans are generally based on small numbers of people, the safety profile of a proposed drug is not close to complete until the drug actually gets to market and a larger number of people get to try it under real-life conditions. Why are there drug interactions? Recent years, researchers have learned that there is a class of enzymes, called the CYP family of enzymes, that plays an essential role in the metabolism and detoxification of drugs. These enzymes act primarily in the liver, but also in the intestinal tract and other areas. For instance, there is a single enzyme that plays a key role in metabolizing over half the drugs prescribed today. Further, it is important to know that many drugs operate within a fairly narrow window of concentration. That is, there must be enough of the drug to be effective, but only a little bit more can be toxic to the body. Now that we know about these 5 enzymes, drugs can be tested by simply seeing if the drug interacts with each of the enzymes in a test tube. Knowing which enzyme actually metabolizes the new drug, researchers can then compare the drug with other drugs metabolized by the same enzyme and eventually build up a list of possible interactions. If 2 drugs use the same enzyme, it is possible that together there might be a conflict. Herbs and drug interactions. We have already noted that St. John's wort has the capacity to affect the activity of certain drugs. It does so notably through its potential to affect the enzyme CYP3A4. What about other herbs? We know that herbs are not routinely tested like prescription drugs. There are no FDA Phase 1, Phase 2, or Phase 3 trials for herbal remedies. Additional investigations have found that kava extract made from Piper methysticum showed the ability to affect CYP3A4, and certain cavalactone compounds additionally affected CYP3A23. Kava also worsens the side effects of certain anesthetics, as does valerian. Mineral and drug interactions. Minerals can form complexes or chelates with some drugs. This creates insoluble structures that the body cannot absorb. Antibiotics and calcium are a known interactive pair. Calcium-fortified orange juice has caused chelation with ciprofloxacin, gatifloxacin and levofloxacin. These antibiotics were made less effective by the calcium, as was the antibiotic tetracycline. Iron forms complexes with ciprofloxacin, as well as with the quinolone antibiotics nalidixic acid and norfloxacin. Iron also binds with the Parkinson's disease medication levodopa. This binding reduces the effectiveness of all these drugs. Caution should be used when combining ibuprofen and magnesium hydroxide, as prolonged use has been shown to increase the risk of gastrointestinal irritation. Vitamin and drug interactions. Interaction between vitamins and prescription and OTC drugs is a wide open field that needs to be explored. We have already noted that vitamin K counteracts the effects of the blood thinner warfarin. It is also known that vitamin B6 pyridoxine reduces blood levels of the Parkinson's drug levodopa. Vitamin supplements, although not at levels typically found in multivitamins, may react badly with isotretinoin, an acne medication. Foods and drug activity. As has been noted throughout this book, supplemental fiber products can significantly delay the absorption of drugs and nutrients. Psyllium-based products used in bulk laxatives, for example, should be taken at least 2 hours before or after taking medication or nutrients. Some products such as bran fiber bulk laxatives and pectin-containing foods such as apples and pears should not be consumed along with a heart drug digoxin. These lower the effect of the drug by binding with it and lowering its concentration. Some drugs that appear to be affected are the antihypertensive drugs felidipine plendil, nifedipine idalat, Procardia, and nitrindipine concept, nitropin. The anticonvulsant carbamazepine. The antidepressant drug sertraline. The erectile dysfunction drug sildenafil Vivatio. The transplant rejection drug cyclosporine Sandimmune Nero. The protease inhibitor Saquinavir inverase Fortivase, used to treat HIV. Reducing your risk of interactions. There are many things you, as a consumer, can do to reduce your risk. First of all, be aware that drug interactions do exist, and that nutrients and vitamins along with food and beverages must be included in the equation. Second, always read labels carefully on both your prescription drugs and any over-the-counter products you buy. There are programs on the internet that will allow you to check for drug interactions by typing in the names of the drugs you are going to take and letting the computer find any adverse interactions. Do not trust any verbal advice unless it comes from a pharmacist or other healthcare practitioner. What worked for your friend or neighbor might not be best for you. Your doctor is a good source of information, but your pharmacist frankly knows more about the actions of drugs and might be a better source. Keep good records of all your medications and their dosages. Make a list and keep it in your wallet. You may also want to keep a copy in your home. It's a good idea to let another family member know where you keep these drug lists. Ask your doctor if there are any foods, beverages, or supplements you should avoid when getting new medication prescribed. When your doctor writes a new prescription for you, be sure to mention the other drugs you are now taking or show your list to the doctor. Don't forget to mention any OTC drugs you are taking. If possible, it's best to use only one pharmacy to get all of your prescriptions. Pharmacies have computer-assisted drug interaction programs that will raise a red flag if they punch in a new prescription and that it will interact badly with your other drugs already in the computer. Not all of your drugs have to be on the same computer network for this to work properly.